Hello, everyone, and welcome to today's webcast, Optimizing the Value of Healthcare Data, presented by National Government Services and produced by GovExec. I'm your host and moderator, James Hanson, Group Publisher of Federal and Technology Markets at GovExec and Vice President of NextGov. Data is the vehicle that drives healthcare towards a higher quality and cost-effective future. Consequently, the information being collected must be reliable, accessible, and universally understood. New tools promise to improve access to services and help ensure end-to-end security, compliance, and interoperability of the collected data. However, the hardest step on the path to standardization and data management is often simply getting started. Today, I'm excited to be joined by Nick Morenos, Director of Information Technology and Cybersecurity at the Government Accountability Office, Lance Scott, Solution Integration Director for the Federal Electronic Health Record Modernization Program Office, Jane Height Syed, Chief Information Officer for National Government Services, and Krista Yeager, Vice President and Chief Digital Officer at National Government Services. Thank you all for joining me. We will discuss the steps necessary to maximize the value of data by leveraging modern technologies that impact healthcare today and beyond. Just a little housekeeping before we get started. Be sure to check out our event resource center in the bottom right corner of your screen. We also encourage you to share your own perspectives and questions via our interactive chat. We hope you'll contribute to the conversation about how to tackle some of the government's most complicated healthcare problems. To start us off, tell our audience a little bit about yourself and how you would describe your role within your organization, specifically around data. Nick, I'll throw it over to you to get us started.
Thanks, James, and thanks so much for the invitation to join you guys for this conversation. So my name is Nick Morenos. I've been at GAO for almost 20 years, so I guess you could call me a GAO lifer. Started right out of my undergraduate degree at Virginia Tech, focused on information technology. And over the course of the 2 decades have delved quite heavily into the worlds of privacy and cybersecurity, in part because of just the level of importance of ensuring that information that is being housed by companies or by federal agencies and state agencies are well protected, not only from cyber attacks, but from misuse as well. So I'm looking forward to the discussion today.
Thanks, Nick. Lance, you want to go next?
Sure. Thanks, James. Appreciate it. So I am the director of the Solutions Integration Branch inside the Federal Electronic Health Record Modernization. Although that is a relatively new title, I've been in this space for quite some years as a program manager for the DMIX program, Defense Medical Information Exchange, where we basically bridge the gap between DoD and the VA as they modernize their electronic health records. I'm really looking forward to this discussion. There's a lot of good questions here. That's it.
Awesome. Thanks, Lance. Jane?
Good morning. My name is Jane Height Syed. I am the NGS Chief Information Officer. I'm responsible for the execution of our IT solutions, our modernization, cybersecurity, all those rainbow of activities that surround IT and the different capabilities. I have over 400 IT professionals reporting into my organization to serve NGS. I've been in the industry and in the IT industry for over 35 years. I've seen a lot of growth in this area. I really look forward to the conversation with Nick and Lance today and Krista. So I look forward to getting this going.
Excellent. Krista, you want to round us out with a little bit of your background and then we can dive into it?
Hi, and thank you so much for having me on this distinguished panel today. I'm Krista Yeager. I'm NGS's Chief Digital Officer, and I have responsibility for the execution of our digital health contracts, which account for just under about $1 billion of our total contract value. I also have responsibility for the growth of the organization and working with Jane to identify new and emerging trends in the digital healthcare space.
I think we'd all agree why this is also so timely is the past couple of years. I think data specifically around healthcare has never been more important. So I am really excited and thank you all for agreeing to participate and support this. Lance, I'm going to start with you, if you don't mind. just given kind of what you just outlined in terms of two of the most complex organizations, largest organizations in the federal government, and the need to share data. So as organizations, specifically the DoD and VA, become even more connected, how can they ensure and harness the flood of data to get real-time insights?
So thanks, James. Appreciate it. It struck me a few years ago when I first started working in this space, one of the biggest hurdles that we had facing us was something, basically, I think we'd all agree that information overload is a problem. We've just got too much information. There is, if we think of in our daily personal lives, all the pictures and emails and texts and everything that we're bombarded with. Now put yourself in the clinician's shoes. The clinician sits down and they have a matter of minutes to see a patient, and they've got literally information from hundreds, if not thousands, of data sources that are all coming in at the same time. And it's up to us in this field to try to make sense of that, to limit the number of screens, to inform our clinical decision support as much as we can, to give that clinician the best, quickest, most efficient view of exactly what that patient is facing at that time. That's what I would consider probably the biggest hurdle that we had a few years ago, and we've made a lot of strides, as we'll see later on, in that arena. But I think that still faces us today. And it's probably only going to get worse as technology improves.
Yeah, I imagine just the increase in telehealth, as providing that data coming in, has created even more challenges. I know that although the VA wants to grow and accelerate the success that they've had with telehealth, moving forward, and one of the lessons learned that they've been able to gain insights from with the pandemic. So I'm definitely excited to learn a little bit more there as well. Nick, I'm going to go over to you. While you cover a whole breadth of government agencies, not necessarily just those with a specific healthcare mission, can you talk about how agencies can harness the ensuing flood of data to gain more insights, how they're doing that?
Sure thing, James. And yeah, I'll build off of what Lance communicated, because I think the important focus here is on what the data can be used for. How can that data improve the healthcare services that are being provided to patients? How healthcare practitioners are able to leverage the power of the data, and how they can ensure that data are accurate and well protected. And I think from that perspective, I think the key emphasis I'd place on are really the tenets of cybersecurity: confidentiality, integrity, availability. All three of those things are absolutely highlighted within the healthcare sector. Thinking about the confidentiality of the most sensitive data, not only from a protected health information, but other data that may be relied upon, could be also financial related information that could be within some of the systems that are being relied upon. The integrity of the data is absolutely essential for providing the appropriate healthcare, and ultimately that availability. We've seen, and obviously we can talk a little bit more later in the conversation about the increase in ransomware attacks. The reality is that the availability, especially when we start to move towards a more remote capability, is going to become even more essential. And we're seeing, unfortunately, the consequences of instances where that availability can't be relied on.
Absolutely. Chris, I'm going to pivot over to you and looking at, from the chief digital officer perspective and helping agencies, connect more and more disparate systems and data together. How do you ensure that with all of that increased velocity, volume of data, that we're able to drive insights out of that?
Well, in healthcare, of course, there are a lot of legacy systems, some giant mainframes that are across the government and that are not easy to interface with or even layer the modern technology on top of. I would say that there's probably also a lack of standardization with the integration as well. along with data that isn't enriched to the point of using it for any of the emerging technologies like AI or ML. And organizations and government often start with the data that's available, but maybe we shouldn't. Maybe it's starting with a problem or the use case for solving that problem, and then determine what data is needed from there so that we can be able to make the actionable insights and solve for the agency pain points. It's really about having a structured process to intake any of these new data sources as they're coming in, that are required to make sure that the data is captured. And it's captured, it's stored, it's secured, and it's easily able to be retained.
And Lance, jumping back to you, starting, obviously, you guys have identified a very specific use case and the ability to share and use electronic health records. What is the first step that agencies, what's the first step that you guys looked at in terms of ensuring proper data management for security, for managing legacy systems?
So I think, and I'm going to go back to a lesson learned a few years ago as well, under my role of PM for DMICS, we had hundreds of data sources. We used to pull together, we still do, we pull together from hundreds of disparate data sources, all the way from in theater records in Afghanistan and Iraq to local around the country, the works. One thing we found early on is the clinician is not really going to care if a data source is down or the system isn't working right. All they know is the system isn't working right. So very early on, we established a priority on building these relationships with our data sources. If we broke down the hundreds of data sources into 8, 9, 10 different major categories, we established relationships with those organizations so that when something did go wrong, it didn't matter if it wasn't my system's fault. The clinician didn't care. They weren't getting the records. We need to, and I think that's really paid off huge dividends over the past few years, and it's true in the future. And everything else that we do is that the better your relationships are with all the tentacles you have out there with those organizations, the better off you'll be.
Jane, looking at how to, like, the first step in ensuring proper data management, Lance just, I think, identified a key one from your perspective as CIO for NGS and working with customers. What are some first steps that agencies should, consider as they're thinking through their data management architecture, governance, management?
So it's a great question. And I think Lance started off the conversation that it's a bit overwhelming, the amount of data that's out there and trying to understand all of that. So, Krista pointed out the use cases. What are we going to use the data for? What is the end in mind that we want to do here? Is it to, ease of access for the provider community? But starting from an IT perspective, if I step back, it's understanding that data that you have today, you have access to it, cataloging it, cleansing it. So it becomes in these usable fragments that can be leveraged easily across many different systems, agencies, providing visibility to those data sources. What do they contain in them? And then making sure we have those tools that are installed so that we can experiment with that data, if you will, and increasing that literacy, that standardization across the agencies, across the healthcare ecosystem, that this field means this, so that everyone understands it's that commonality that's needed. And let me just point out one more. I think that governance is going to be important in all of this as we look across the different agencies and we look across, we're all trying to solve the same problem and get to the same point. So understanding the data and the governance that goes with it to understand how to use it, who can use it, when, and securing that within those boundaries that we have.
And Nick, I think, Jane and Lance have outlined a key kind of tenet to where government has been trying to go at large is really looking at data as a strategic asset. From your experience and your work with multiple agencies, how have you seen agencies leverage data as a strategic asset? Kind of where do you start? I know, security is a key component to your pillar and area of responsibility. Managing that data is as a strategic asset essentially does help ensure compliance and make it more secure. What are some of the things that you're seeing agencies do to take good steps in managing data as a strategic asset?
James, I think the focus on digital services has probably been, one of the big pluses over the last decade. In other words, to really try to tie sort of the customer experience, what the purpose, the mission of the agency is, to not only to the data, but to the offerings that are being provided through the information technology that's being managed. And I think that's important as well, because, in instances where we've seen agencies set up digital services groups, or they're leveraging the US Digital Service or 18F, entities like that, ultimately that's also bringing in the factor of how legacy IT might have to be factored in. We've talked about that in a couple of cases here. And likewise, making sure that security is something that's being considered up front. I think what we've also seen over the last decade in reviews that we've done on behalf of Congress, looking particularly at a focus on the Chief Information Officer's role, the Chief Information Security Officer's role, is that success tends to happen when the C-suite entities are communicating with each other. And this is really important for several reasons. The first being that a CIO, although in an ideal world may have control over the entire budget at a federal agency related to IT, that just simply is very, very difficult to achieve, especially considering the more federated agencies that exist out there. So likewise, that's in other words, that CIO is going to need to have good relationships with chief procurement officers, chief human capital officers, as well as obviously the chief information security officer. Then on the security side and privacy side as well, so think about the chief privacy officer. If those relationships haven't been established and the agency heads are not reinforcing the importance of having these communications happen early on in thinking about how the data can be used, then there's a tendency to put privacy and security on the back burner until it gets confronted with something important, whether it's key milestone for security assessment, or let's be honest, a cyber attack occurs and we see that there's vulnerabilities that have been exploited. So the earlier that those relationships can not only be built, but to Jane's point as well, with respect to governance can really ensure that those relationships are working properly as well. So I think that's what we've tended to see when data has been leveraged for customer-focused missions.
Yeah, no, I agree. We've been covering this issue for more so in the past 18 months, obviously, and we continuously hear as we have conversations with government leaders about breaking down data silos, and that is a critical component and approach to ensuring that everybody understands the path for data. If we go to the next layer then, Nick, from a technical perspective, what do you see like after, that kind of strategic plan is identified and those governance models are put in place? Where are you seeing technical challenges across those different stakeholder groups? And again, in order to ensure the ability to secure, drive outcomes and insights from data?
Well, the healthcare sector, I think, makes it pretty tough. It just inherently by what services are being provided, obviously very patient focused, and that's going to require a lot of data to not only be, intaken, but also shared in order to be able to provide those services. So jumping to privacy for a moment, we need to recognize that we don't have a national privacy framework. GAO has actually been calling for Congress to consider passing legislation along those lines since 2013, in part because we're really then left up to state and local expectations and requirements. And we know that states have a vastly different array of privacy expectations and laws in place. And so what that does for healthcare sector organizations is it makes them have to keep on top of how their work and their interaction with data are meeting these specific requirements depending on which location. And there are very few organizations that are one state only. So there's going to be a lot of expectations and pressure for them to meet these standards. Likewise, on the security side, yeah, we're talking about the pandemic. We've seen an increase in remote use, and we've also seen an increase in targeting the healthcare sector specifically. I think Mandiant identified it as the #3 targeted sector just this past year. And predominantly with ransomware attacks, we've seen FBI almost on like every 6-month basis coming out with specific warnings of ransomware attacks within the healthcare sector. We've seen the Cyber and Infrastructure Security Agency, CISA, putting out specific guidance to healthcare sectors. Now, where does that leave an individual organization? It leaves them only as positioned as they are to be able to have the expertise in-house or have vendors and contractors on site to be able to actually protect them. So there is a challenge to taking that information and then taking action on it. We've even made recent recommendations to the Department of Health and Human Services, to HHS, which plays that focal point within the federal government to the healthcare sector, that it needs to do a better job to make information available and be able to share cyber threat information more quickly to the healthcare sector itself. And lastly, on legacy systems, the reality is that many systems are not built to interact often with those that they ultimately have to interact with. So, and obviously this is an area that I'm sure Lance could talk plenty about, but like the importance of planning ahead of time for that interoperability to be able to happen. Otherwise, integration continues to be a very big challenge, not only within the healthcare sector, but across all technology related sectors as well. Ultimately, you're going to be spending more money at the end of the day, and you're going to have potential complications, which could also lead to security vulnerabilities as well.
So Lance, obvious transition over to you. The interoperability piece certainly has been one of the big focal points for you guys. Can you talk a little bit about how you're working to manage that, and what role does that play in driving standardization of data and ultimately security of data?
Yeah, that's been extremely challenging. Just when you think you get something down pat, something comes out of left field and kind of throws you a curveball. We've something Nick said reminded me of the privacy standards not really being standardized across the country. We connect 240 different resource or data sources come from what's called Ehealth Exchange. They have in place a DURSA, which is basically a data use and reciprocal agreement that makes it easier for one organization to connect to many. That being said, there's still, every once in a while, there's still some oddball things like a few months ago, we lost 3 New York HIEs for a matter of months because their privacy people got involved and said that they were not allowed to share with anybody but us, meaning they were going to withhold sharing data with the rest of the Ehealth Exchange. Thankfully, that was changed, or that they did come to an agreement on that. However, it's a very diverse field we work in. There's many things, even though we think we have it standardized, a lot of times we don't. One area that I'd like to touch on is my organization puts a lot of effort into parsing out data from CCDAs that we get from our partners. We've got many, many hundreds of data sources. Well, 240 of them come in as continuum of care documents, and basically our people have to do kind of a Herculean effort to parse that data out and make it computable and put it into widgets so the CDS tools can work. That's not a small effort, and we've begun inroads into instead of CCDAs, basically connecting via API and using Fire to transport the data. We've seen some massive successes in that area. We've only got about 8 domains out of 22, 23 that we want to get established between the Cerner Millennium product and ourselves, but we want to expand that. We also want the Ehealth Exchange to start exchanging data with us via APIs. What that does in the end is it really means the more I can connect from API to API, computable data to computable data, and I bring it in exactly as I'm going to display it, it makes it far easier and more efficient on my people to put this into a GUI that the clinician can understand and appreciates and helps him or her with their time. It's a huge effort, but they've already made much faster inroads than I thought they would, and I think over the next year we're going to see some pretty big leaps and bounds in that area.
Jane or Krista, I'd ask, based on what kind of Nick and Lance outlined, and those, some of the technical yet, governance and process requirements that are needed to better take advantage of data and also to secure. Is there any other technical challenges that they didn't touch on, and if we don't address these things from a technology perspective, what are the challenges that we could ultimately agencies could face down the line?
I'll go ahead with that one, Krista. One of the things I look at cost. I mean, from an IT perspective, that investment that you need to make to get out of those legacy systems, and assessing your architectural, the technology changes that are needed in order to progress where you need to. So I would say the investment is one of those challenges that we have. We're also shifting to consumption-based models, and that is really where we need to go, where appropriate in the different areas. Rewriting our applications and retiring our applications. We've been successful in taking some of those legacy applications we have and rewriting those into low-code development, which has served us well from a software engineering perspective. And I also think there's a lot that still needs to be said around the entire ecosystem and being able to be on the same page. There's dependencies that are there across many different organizations, and some may view security, as you bring up, Nick, differently than other organizations or have different requirements. And so those interdependencies within the organization, I think, are also a challenge, and not having a national direction, if you will. So while I think in our own organizations, we can overcome some of those challenges, but as we start to bring this together in the whole healthcare ecosystem, we're going to continue to hit those dependencies. We're going to continue to hit those challenges, but awareness is the first piece.
Can Jane, if you don't mind, I'll come back to you. Can you expand a little bit on the consumption model? Are you referring to?
It's yeah, just as it sounds. As much as you consume is what you pay for. I only need 6 licenses. I only pay for 6. In the past, we've always had to, you buy enough seats, and this is a very simple example, but you buy enough. We only sell increments of 60. Well, I only need 10. These days, it's a little bit different in this new technology and what our vendors are offering. So we also look at how we have our infrastructure set up based on the contracts and who uses those contracts. We do it based on consumption, as opposed to having to buy the whole infrastructure and pay for the entire infrastructure. That's what cloud allows us to do in some of these newer technologies.
Yeah, certainly total cost of ownership is
right.
Hopefully where, and I do believe that agencies are starting to move towards. I want to touch back on just quickly, obviously the last 18 months with the pandemic has changed the way we work and operate. and we're still trying to figure out the way that the future of work looks. But Nick, as from a cybersecurity and security perspective, as essentially workers and agencies has moved remotely, it's opened up additional threat vectors, endpoints, and most agencies now are moving towards zero trust architecture. When you think about data, how should agencies, what's the model that you see agencies really starting to move towards, and how do you essentially put a price tag around what data you should be protecting? Healthcare, certainly there's a lot of rules with HIPAA and things in place across federal, state, and local levels. Just curious to get your insights into how to be thinking about what data, what level to be protecting and securing.
Yeah, it's clear that within any organization, there's sort of a level of importance to data and a level of sensitivity as well. So just like sort of the old tenets of security, you can't protect what you don't know you have. So the most important thing I think out the gate is to have an inventory. So I think that speaks to going from a strategy with respect to data to thinking about data security from an inventory perspective. So ultimately trying to figure out what are the data sets that you really need to protect. And then how are you going to be able to grant access? So the notion of zero trust security is to start from a very small, almost nobody, to granting access to that information only as it's absolutely necessary, and that you have the protections and controls in place to make sure that that happens in the way you intend. So talking about the last 18 months, as we've discussed here, there's obviously been a necessary push towards more remote capabilities. And likewise, we've seen on the attacker side, a heavier emphasis on those remote capabilities and trying to exploit the distributed workforce that seems to be at least in place for the near future. You combine that also with cost savings that can come from using cloud computing solutions, which I think I echo Jane's comments with respect to sort of the benefits that one can see, or cost-cutting measures that like software license inventory. So just having an awareness of what's being used across an enterprise. You may not be getting the best bang for your buck. You may not be getting the best price if you're not quite aware as to how much you need of a particular service. But with all of this, security becomes more and more complicated. We're not new to relying on others for IT services. Of course, within the federal government, state and local governments as well, rely on contractors, rely on third parties to provide the IT services, and in most cases to protect them as well. But I think we also can fall victim to out of sight, out of mind in that case. So I think it's extremely important for any healthcare entity to recognize the responsibility that they not only by law continue to have to protect the protected health information, regardless if it's someone else that they're relying on to do the processing, but then to sort of build out the capabilities to have ways to confirm that what a vendor or a third party provider is saying they're going to do to protect the information is truly what they're doing. This can come through having experts or knowledgeable individuals that can review assessments or perform those assessments on not only security, but privacy controls as well. Have ways to be able to vet and ensure that folks are protecting the information. Within the federal sphere, we have the benefit of the FedRAMP program, which is intended to sort of vet and certify certain cloud computing solutions, but that doesn't take an agency off the hook, that once they've acquired the capability that they then have to have some way to follow to make sure that they're protecting the necessary services that they're providing.
Jane, I saw you nodding your head a little bit there. Is there anything that, just from, again, ensuring that you have visibility into the different security protocols of different levels of data? And you talked about cloud, which is certainly, working that effort. Anything else that you would add in terms of, healthcare agencies in particular, and ensuring visibility into what data to protect, how it's being protected?
Yeah, security is the utmost importance for everyone here. I mean, it's at the forefront of every solution that we do out there today, and it should be, because it continues to evolve. Cybersecurity, those bad actors are out there. They continue to evolve. They continue to find those ways to get into the data. And so our approach at NGS is really to make sure our security team is involved in every solution that we do today, and become a trusted partner within the organization. There are very specific requirements, the FedRAMP requirements, FSMA High requirements, that we hold ourselves accountable to, and we audit ourselves to those requirements. I think what's really important for us to think about when it comes to security in this area is that you have various different layered controls. Here's a control that the organization or the data goes through. That doesn't work. There's another one. There's a different layer of ways to identify potential attackers. We also make sure that we're staying most current with those the industry knowledge, the new emerging technology that's within security, because as I said before, it continues to evolve. And but what's most important is the people that you've got working on it, and their understanding that data protection should be their first stop, their first thought. And we've been able to work through that in organizations. So when I look at security and the data that we're asked to protect, it's at the most front of our conversations.
Lance, in terms of the pandemic, not necessarily how the DoD and VA are working, but from your role in particular, and we mentioned earlier in the conversation, the VA is definitely trying to accelerate its overall telehealth, telemedicine capabilities. How is that impacting the way you guys are thinking about electronic health records modernization and management? Has the pandemic completely changed the thought process? Has it accelerated in any way? And certainly, I mean, I think we've hit the nail on the head on the security part. That's definitely an element of it. But how has it changed, if any, at all, the way you guys are thinking how these systems connect and exchange and manage and collect and drive insights on data?
No, it definitely has, James. I'll pause the COVID question real quick to talk about cyber, because I think it's important that we say this. I don't think that it's a matter of which cybersecurity model you decide to choose, is that you all use the same one. It's very apparent in our environment, because it used to be DoD MHS Genesis all by itself. And then the VA adopted the Millennium platform. Now the Coast Guard's also in our deployment field, and there's more than a few that are in negotiations to come on. These are organizations from across the spectrum of governmental agencies that only had one thing in common. They all did things a little bit differently when it came to cyber. What we learned early on is, do not create those artificial vulnerabilities, those seams in between organizations, but instead focus on, okay, we all agree to use one cybersecurity model. And I think that has really paid off big dividends with MHS Genesis and the progression of the electronic medical health record. Onto the cyber piece, or onto the COVID piece. This has been obviously extremely challenging over the last year. We've seen a massive upswing of telehealth and video visits, which has required our functionals on both the DoD and the VA side to rapidly address these solutions. How exactly would they do them? They've put some capabilities in the field in record time, I think. But this is also, it's also posed a cyber challenge. I mean, there was very early on, we questioned, we had to track the COVID-19 vaccinations. There was some serious cyber vulnerabilities that I don't want to get into specifics of, but that had to be addressed early on. In major data centers were brought down, and others were stood up in the cloud, as was spoken earlier. That gave us much more scalability and expansion and de-expansion, and to bring in these assets on as we needed them.
If I can interject here too, when Lance, you used the word rapidly, and I think COVID is a great example of when organizations, agencies needed data rapidly. We had to make sure the data was there, it was available, it was the right data to use, and then get those dashboards created because everyone was looking at them and everyone needed that data. So, I mean, this was a good example of, I think, where the industry came together and got at the data and was able to present it in a way that our government had data to have access to make decisions. And I think that's a good example of where we came together very quickly.
Well, I just follow up on that, Jane. We touched on it. Lance mentioned it in terms of leveraging and integrating APIs to connect data and systems, and Krista kind of extrapolated on that. I would like to follow up on that and thinking through accelerated. There are emerging technologies like AI, ML, and certainly I think automation and RPA being leveraged in the healthcare space and adopted as quickly as other sectors and agencies. Can you talk about how emerging technologies like that will impact the healthcare space, and maybe specifically how it will impact the way agencies can use data or drive data?
I'll actually take that question. From an emerging technologies perspective, NGS has been involved with RPA, low code development, AI, ML, but honestly, it's really about the data innovation, the use of new or non-traditional data sources and methods that we can gain more understanding from, or explore the unknowns, or create new data things. And it's really, if we think about it, the first step in capitalizing in any of these emerging technologies, AI or whatever it might be, is to invest in the right talent, invest in the technology needed to mobilize that talent. And as I mentioned earlier, it's really about identifying use cases and build an outcome-based approach so we can really use that data innovation. Because without the data, without the right people, there's essentially no intelligence to provide the insights to.
100%. Nick, I'd love to get your insights and perspective. GAO definitely has been covering the topic of emerging technologies regularly, and AI and ML and RPA have been a part of that. What are you seeing in terms of how that is going to have an impact on how agencies can leverage data, whether that be from a security perspective or simply driving insights and intelligence out of it?
Yeah, I think to speak to the latter, there could be huge benefits to this. If you've got a good data strategy in mind and can apply the emerging technology to that data, there are a lot of things that can be gleaned out of the information. Efficiencies that can be gained, but also insights as well. And actually GAO, led by our science, technology assessments and analytics team, is looking squarely at the issue of artificial intelligence within the healthcare sector right now. We've also recently released an accountability framework for artificial intelligence, because we ourselves, as well as other audit institutions, are recognizing that, at the end of the day, the more that we automate the decision-making within an organization, the more that automation needs to be well regulated. We need to have, certainty that assumptions are being made in a way that we're comfortable with. And certainly from a security and privacy perspective, there could be benefits here. There could be benefits from a privacy perspective if law and regulation is clear, then those laws and regulations can be applied to the use of the information, even from an automated perspective. We've seen this already within the way that sort of strategies are taken for filtering out, the information to ensure that that information is not leaving an organization that shouldn't be, as an example. But the more that you ratchet up the automated nature of the use of technology, the more that we need both human-based security and privacy protections and those automated protections to work as intended.
No, absolutely. So as we wind down here, and again, I just want to thank you all for your time today. I want to just touch on from a non-technical perspective and think through, culture, people, management, and how do you ensure data is really fueling insights and action, and ensuring that the people are able and understand the opportunities available with data. And so, Lance, I'm going to start with you again, as coming from one of the most structured, top-down type of organizations where people really drive outcomes. I mean, they do in all agencies, but certainly the ones that you're working with. Can you talk a little bit about the importance of people and culture to drive data management, to get the most value out of it?
Sure. This is definitely an issue that we were faced early on with, is the very different cultures between DoD and VA. It was very much a learning process in the beginning. We've made huge strides over the years. I honestly, I never would have forecasted that it would be as good as it is today. The DoD and the VA, now the Coast Guard, and like I said earlier, many more on the horizon. We're very rapidly realizing that we have much more in common than we ever did apart. One of the biggest things I see in the data space is trust and validation. I said earlier that one of the biggest problems we face, our clinicians face, is information overload. There's just so much data that's out there. Part of that is getting that data into the record. And now, from an interoperability perspective, whenever something is auto-ingested, I think of that as that's less time that the clinician has to spend on that record. When they're looking at it, they don't have to go out and reconcile data from outside sources into the record. Part of getting something auto-ingested is a very precarious process. We have to put something called trusted partners online, and there are actually certain domains inside information that you pull from that trusted partner that are actually auto-ingested into the record. The clinicians take that very seriously, but the more we can do on this, the better we can start normalizing, standardizing, and trusting the data that we bring in. The easier it'll be on the clinicians, I think, on their workload.
Crystal or Jane, would you like to add a little bit to what Lance said and close us out?
Yeah, thanks. And actually, playing off of what Lance just said around trusted partners and normalizing the data, it's really also employing iterative thinking around that data, understanding what question was asked, what did we learn? So what does that mean? Now, what is the next question that needs to be asked to gain better understanding? And that way we can take those calculated risks and achieve a higher level of learning and gain those insights to be able to better understand the outcomes.
I just wanted to add a couple more things here. I think enabling a healthy atmosphere of accessibility, kind of where we started the conversation today, around openness, around collaboration, that supports that constructive data governance across all of our organization. And that means working across these traditional organizational boundaries that previously were in place, similar to what Lance mentioned about DoD and VA working together, or what Nick mentioned about the role of the CIO and the ability to build relationships within the C-suite to establish that governance and how important that is. So I think that's one key thing. And then I'll end it with, Lance mentioned the clinicians, and really they are, in a lot of circumstances, our end user, and using human-centered design and taking the approach of what does the person at the end of this game really need? And the fact that the clinicians are overwhelmed, how do we get to making it better and improving healthcare and its accessibility at that point? And then I'm going to finally end with one area that those who know me, it comes back to me, but people are our greatest assets here, and creating an environment for experimentation and hypotheses testing that allows for data to be examined, creating that data innovation that Krista referred to earlier, and to solve those challenges for the clinicians. So that's, I think, if we sum it up, people are our assets, correct data management, all of that brings us into this great data area that we're in.
No, I think that makes a lot of sense. I just want to thank again. We're unfortunately at the end of our program. Nick, Lance, Chris, and Jane, thank you again for this discussion and for your service and efforts to improve the overall quality of healthcare in our great nation. And I want to thank our audience for tuning in for this special program, Optimizing the Value of Healthcare Data. If you missed part of the show or you want to share with your colleagues, we will be sharing the on-demand portion of the program as well. For GovExec, I'm James Hansen. We'll see you next time.